My name is Gerard Green. I'm just going to tell you a little bit about the Advanced Clinical Reasoning and Manual Therapy course. The first section of the course is really looking at the history taken with the patient and looking at trying to embed a mechanisms-based approach to that. So we look at identifying tissue mechanisms, looking at identifying pain mechanisms, at genics such as arthrogenic, myogenic, neurogenic mechanisms, and also looking at are there obvious cognitive, behavioural, emotional, social and work factors. We then go on to really start that differential diagnostic process using subjective questions, very targeted questions to the client. So that leads nicely into session 2, which is looking at the functional demo or the patient's meaningful task, and we use that very practical interactive session to do a lot of differential testing. So if that's like a shoulder activity, maybe a functional knee squatting activity, and how we can use that to differentially test and start to do some mini treatments. Next session looks at MWMs, but rather than just using mobilizations with movement for treatment, we're going to use MWMs as a really important assessment technique and approach, and really clinical reason through is there an obvious arthrogenic component that the MWMs will identify. And we use a lot of the MWMs in very functional weight-bearing positions, both in assessment and as in treatment. Next session then takes us on to the neurodynamic testing, and what we really look at is how the pain mechanisms can really affect the interpretation both of the neurodynamic testing and also the other objective testing. So really emphasising the role of identifying those pain mechanisms. And we look at refining the neurodynamic techniques and also look at doing some interface techniques in assessment and also combining some of the neurodynamic testing and treatment with some other concepts. That takes us nicely into some of the refinement of the manual therapy techniques, and we're going to look at some cervical techniques such as the anteroposterior techniques, how we can use them maybe in combined positions, and we're also going to do some lumbar and thoracic techniques, which then means that when we do the thoracic and lumbar manipulation, it's really a progression from the mobilization. And really the emphasis on the course is really using a real clinical reasoning approach, and also really underpinning that with the published evidence. Thank you.